Dr. Haney.
All right. Just a couple of quick updates. First of all, our fall enrollment is down 1.3% at college level, but only 0.5% in all levels. You'll recall we budgeted 1.3% down, so we're right in line there. There's good news. Smallest decrease in enrollment amongst our peer schools, so we're happy about that. On a positive note, our online enrollments continue to be a source of growth, with enrollment in online up more than 6%. As we talked with the board, one of the things you're going to see is a renewed focus on our online campus as we look to improve our success rates in online education. As a follow-up to the flood, we did fall short, the whole state of Illinois fell short in uninsured claims, so we will not be receiving FEMA assistance. While it would have been nice to get the additional coverage, we're still fortunate that our insurance deductible of $126,000 are the only costs that we'll have to bear. And I think, Ken, our damages were somewhere in the neighborhood of 1.6.
Correct.
Yeah.
We've actually received a payment rate from the insurers for about $400,000, so some of the money starting to come in.
Fantastic.
HLC accreditation update. I hoped we'd have good news, but we still are waiting for our letter from the HLC. I believe they voted on our reaccreditation last week. Usually takes a week or two before you get your official notification, so I'll keep everyone posted. Great event we had last Wednesday. We launched our supply chain management program. We had a media event. As you may recall, Granger is one of our founding partners and provided financial support. The event was attended by local media, representative from Granger, Lake County Partners, the Workforce Development Board. I'd like to thank Dr. Stomper, Lori Oriati, Bob Dodd for their work in developing the program. We're very excited about it. We're already seeing students get excited about it. So it was a great event. I want to thank Ann for all of her work in setting that event up. So that was great. Latino student success. In my comments to the college community in August, I noted our progress on improving our graduation and transfer rates, which is great news. But we still have work to do as we look at equity outcomes, particularly in regards to our African-American Latino students. Latino students make up 36% of our student population. To that end, I was recently asked to join a local chapter of Presidents for Latino Student Success in partnership with Excelencia in Action. A team of us, including Karen Lavin, Allie O'Brien, Teresa Albanado, Nick Branson from IAPR, attended our first meeting on August 31st and met with 8 to 10 other colleges and universities to discuss best practices in Latino student success. During the next year, we'll be working with local and national partners to learn more about how we can improve programs and services in support of the Latino students. We already have several special initiatives that are proving to be successful. I'll keep the board informed as we move forward. Before I turn it over to Dr. O'Brien, I wanted to point out that in front of you are copies of the new marketing campaign designed to showcase some of the extraordinary things that are happening at the College of Lake County. As you may recall from last month's board meeting, Karen's holding up the copy. We highlighted our fire science program. You have the ad copy for both fire science and some of our healthcare programs in front of you. As we're rolling out the campaign, it will include print, social media, web, and other channels of distribution. Ultimately, the goal is to share some of those extraordinary things and good times here at the College of Lake County. We'll be rolling out one new extraordinary thing each month. So I just wanted you to see all of that. All right, I will turn it over to Dr. O'Brien, who will provide an overview of our next highlighted program.
Well, thank you for allowing the time to talk and brag a little bit about our healthcare programs. I wanted to first acknowledge that Maureen Robinson, our Dean of Biological and Health Sciences, Jeet Saney, our Interim Associate Dean for that division, and Lynn Weicker, our Department Chair for Medical Imaging, really helped contribute to this program and dig down and get some great statistics for us to share. So Maureen and Lynn are with us tonight, so I just wanted to thank them, and Lynn's going to join us here in a moment. The first thing I wanted to highlight for you is kind of the scope of our healthcare programs. Many times when we talk about healthcare, we think of our nursing program, our medical imaging program, but we're very fortunate that we span both transfer, career, and professional or vocational training programs. So you can see the variety here, and one of the important things to note with our career programs, of which we have 10 that are showing, is that each of them are professionally accredited by a professional organization or body. And this is significant because professional accreditation for a program means very intense scrutiny of our quality, our outcomes. They hold us to very high standards, both faculty training and credentialing, and then our students are held to high standards through that accreditation process. It also takes a significant amount of time to maintain, to keep up with, and to adapt along with that professional accreditation. It really ensures that our curriculum is matching those industry standards. They do an amazing job of staying on top of that, given the volume for one division to manage. One other thing to point out with professional accreditation is it sets our students up to have access to take professional licensure or certification exams, which are really important for them to be viable in the workplace. So very critical and important to that program's success. I'd like to share with you some impressive stats about our healthcare program, starting with our faculty. And one of the interesting things is to think about, again, their level of education and their practice experience in the field. So you can see here that many of our healthcare full-time faculty hold doctorates. Our adjunct faculty do as well. We're, I think, Julie, if I remember, in the 70s in terms of number of adjunct faculty that are holding high credentials. And then most importantly for our adjuncts, they are coming to us with very relevant and timely real-world experience. So having doctors and chiropractors and dentists that are practicing on a daily basis coming into the classroom to work with our students really enhances their learning experience. And when you consider the amount of teaching experience that we bring into the classroom, just with our full-time faculty alone in the healthcare areas, I think that is extremely significant and important for our students to have very seasoned and amazing faculty in front of them on a daily basis. Another thing to recognize is the level of national recognition and prestigious awards that our faculty have earned. This is a great picture of Dr. Carmela Michael, who is in the ad also that you have at your place. Carmela was inducted into the National League of Nursing Academy of Nursing Education as a fellow, and there are only 234 fellows in this academy, and only 3 Illinois Community College faculty have ever been inducted. And Carmela is one of them, and she's currently the reigning Illinois Community College faculty who holds this position. And she brings to the classroom over 35 years of experience just on her own. In fact, 5 of our full-time nursing faculty have over 30 years experience. And again, just significant numbers to impact our students. Very proud of them. And other healthcare faculty get very involved at a national level, serving on certification boards or professional associations, getting involved in site visits and peer reviews. So again, staying up to date and very relevant only helps our programs grow and stay current. We also have some impressive partnerships to brag about. Our clinical sites are integral, and literally our programs cannot exist without them. So having over 40 clinical site partners is great, but what's interesting is many of those clinical sites host multiple programs. So that partnership number just continues to grow and compound. We're very proud that when we launched our employer partner program last year, that all the gold members happen to come from the healthcare areas. And again, signaling their level of commitment to the college and how they accept students, support students, and ensure that our faculty are up to date with their curriculum. Another exciting partnership we have that we've been able to talk about before and we want to continue talking about is our relationship with the Chicago Blackhawks and the National Wellness Institute. So our students from the Health and Wellness program have access to help coach and prepare with the Chicago Blackhawks team. And through Dr. Frank Ardito, that's just been a super exciting opportunity for students to get involved with a professional sports team. Also, one thing that is important for Lake County is our relationship with Rosalind Franklin University of Medicine and Science. Students who start at the College of Lake County have the ability to immediately transfer to RFU in their PharmD program. So it's an Associates to PharmD program. And when you look at the median wages and the opportunities for careers as a PharmD, that is something that is, again, a very high quality educational opportunity for students.
I'm going to say, I don't know if this is true, but I'm going to say it. I think that's probably one of the only ones in the country that has an AA to PharmD.
I think what's unique.
Don't fact check me.
Yeah, I don't know if it's the only one, but I can tell you that what is unique about that is the guaranteed interview spots and guaranteed placements that RFU holds for community college students from College of Lake County. That's very unique. I know that's a stand-up component of that program. And finally, on this slide, what I wanted to mention about our EMT program is the EMT program is held at the hospital, 3 hospital sites throughout Lake County. There's a voluntary accreditation program for EMT providers to become accredited. All 3 hospitals have done so in Lake County. And what's so unique about that is it allows CLC graduates to be able to sit for the National Registry Exam, which is a portable credential across every state in the U.S. So instead of having to worry about a state-by-state licensure to be an EMT in practice, our program and the ability that the hospital accreditation provides our students is for them to have a transportable credential that moves with them, which is really significant that all 3 of them came together to take that level of commitment to accredit their programs. Next, I'd like to talk about some of the outcomes related to our programs, and the numbers really do speak for themselves. One of the kind of infrastructure components to these healthcare programs, many of them run as a cohort model. So students enter together, they lockstep through a program together, they complete together. And we do see that a cohort model really does provide a lot of structure for them to get to that completion point. But even more important is their licensure pass rates. This is what allows them to work and earn and grow in a career. And you can see that we far exceed in many program areas the national averages in those pass rates. And just a testament to the commitment by our faculty and the students' dedication to really take the program seriously and be successful in that. Next, one thing that is a wonderful number to kind of throw around is how many healthcare professionals has the College of Lake County credentialed since the college opened. And it's a little over 16,000. Which is pretty amazing. You can see the span, and especially, obviously, at the top, certified nursing assistants and nurses alone top of over 9,000 credentials, certificates, and degrees that the college has awarded. This number is only going to continue to grow. The demand is definitely there. And again, maintaining those professional accreditations and focusing on the outcomes really is going to support us into the future. Next, I am going to have Lynn Weichert come up and tell you a little story about an impressive student, Diana Bradley.
Thank you, Dr. O'Brien. Good evening, everyone. I'm glad to be here to talk about one of my own students. It's a great privilege. Diana Bradley is a first-generation student. She is from North Chicago, and she is a single mother, and she started the medical imaging program in the fall of 2015. During her education, she had obtained several different scholarships, such as the Granger Community Grant, the Program Tech Ed Scholarship, and the CLC Foundation Scholarship as well. In July of 2017, she graduated with a GPA of 3.33, and she also obtained a full-time position at Vista Health Systems as a cardiac cath lab and interventional technologist. That is not an entry-level position for most of our graduates. It's actually an advanced imaging modality that she obtained upon graduation after 2 years of medical imaging training here at CLC. It is spectacular. So Diana was not able to join us this evening, but she did want to leave a few words. So if you don't mind, I'd like to read what she had left. The College of Lake County provided me with the tools and education that I needed to succeed in my new career. The anatomy and physiology classes that the college provides are the backbone to the medical field. Without those classes, I wouldn't be doing what I am now. The medical imaging program gave me the medical knowledge and experience that would be critical to my career in the medical imaging field. The clinical experience was exceptional, and the hands-on experience gave me the opportunity to show my skills and prove myself as a desirable employee. The past 3 years were tough and at times very trying, but with the support of family, friends, fellow students, and professors, I gave it my all and pushed through. I am forever indebted to the college for the chance to shine. I couldn't have done it without the generous support from scholarships and grants. I am happy to say that after a total of 3 years of being poor and on welfare, and sacrificing everything for my career and a chance to change my life, I am currently holding a position as a cath lab and interventional radiologic technologist at Vista Health Systems. And not to share my current salary, but I will say this, she has a little bit of sense of humor. A class during your senior year to prepare you for what I now know is called tax brackets should be included in the program. I am forever grateful to the college for helping me succeed. So on behalf of Diana and myself, we thank you for letting us take the time to share her story, and maybe we'll work on those tax brackets.
Great, well that's one story of many, many stories that we could have chosen. But I know what an impact Diana had on Lynn and the program and her fellow students, and just her amazing first position speaks volumes. So lots of impressive students in the program. Any questions or comments?
Wow. Absolute wow. It's amazing how much our programs continue to grow, and what a wonderful testimony. Beautiful. Thank you for sharing that.
Thank you for having us.
Thank you.
Well, again, at each board meeting, I'm going to try to bring something like this. When you think about the College of Lake County, you think about all the lives that we touch every single day. When you look at those numbers of healthcare professionals that we have in Lake County, that is very impressive. And so again, I just thank the board for all of your support, because it takes a lot of people to make these things happen. Maureen Robinson being there, Dr. Weichert, all the faculty and staff work so hard to make those kinds of things happen. Healthcare accreditations are a lot of work, but they really mean something to our students. And so again, I'm going to continue to try to bring these kinds of stories to the board, so you can see the impact that the college has.